Good afternoon. Welcome to the weekly Winnebago Tribe COVID pandemic update. I'm happy to join you today and represent the Tribal Council. My name is Victoria Kitchion, and I'm the current Tribal Chairwoman of the tribe. I'm very thankful that we could have all our principal entities gather this afternoon to provide these updates to the community and the tribal members that are bearing through this pandemic, and that we can offer this communication to show you all the good work that is underway and going to be continued to ensure the safety and wellness of our community. So with that, I would like to turn it over to our first presenter.
Hello, my name is Danelle Smith, and I'm the CEO of the Winnebago Comprehensive Healthcare System. Thank you all for joining this week's community update. I hope you are all healthy and doing well. As we move into the fall and cold weather season, I would like to encourage and remind each of you about the importance of keeping up with your routine healthcare needs, including annual physicals, dental appointments, regular follow-ups with your medical provider, and so on. The 12 Clans Unity Hospital and the Winnebago Public Health Department are here, and we are open, and we are ready to serve you. Processes and protections are in place throughout the facility to make sure that you can safely access the care that you need. We have increased cleaning throughout the facility. Staff are wearing PPE. Plastic barriers are set up at the registration and reception desks, and along with waiting areas to help with the physical distancing needs throughout the waiting room. We also have masks and hand sanitizer provided for patients and visitors at the entrances. We have increased air filtration in many areas of the hospital, also to help with ventilation. Whenever appropriate, we are also working very hard to make telehealth services available, and those options available to you and accessible so that you can access your health care in a way that makes the most sense for you. If you have been delaying any of your healthcare needs, please do call and make an appointment to see your provider. Our team at the hospital and at the health department are ready to serve you and answer any questions that you might have. Lastly, I would also like to remind you that the flu season is upon us, and that flu shots are available through the pharmacy Monday through Friday, and you do not need to have an appointment for a flu shot. You can just stop by anytime Monday through Friday during regular hours to get that flu shot taken care of. We highly encourage everyone to get a flu shot, especially with the COVID-19 pandemic continuing. And at this time, I will turn it over to Mona Zufante, our Public Health Administrator, for this week's presentation. Mona?
Thank you, Danelle and Tori. Good evening, Winnebago community. As always, our prayers and thoughts are always with the families in mourning. As I understand that there was a death with the Crosby family. So just a reminder about what occurs with contact tracing. First, the primary provider calls the individual to let them know the outcome of their test. Then the PHN nurse will call the positive individual. The individual is interviewed about their symptoms and when it started. And right now we're looking at 3 days prior to when your symptoms started. And then we ask all the people that you've been in contact with that was less than 6 feet and more than 15 minutes. Then those individuals, we get that list, and then we start contacting them and placing them into quarantine for the last day of the exposure for 14 days. So just a reminder to please remember to wear your mask, social distance. We just can't say that enough. Sanitize your hands before touching your face. We've seen a lot of people lowering their guards when they're visiting their family. So please make sure that you wear your mask if you're not, if those are not in your household. We still have housing options available for those that need to quarantine or isolate. So please contact your PHN and let them know. And I will start going over the presentation for today. So actively in Winnebago, we have 144 positive cases over this time. We've had 6 that are currently active. 14 households are in quarantine. We've had 135 of our positives recover, and of course the 3 deaths. The age breakdown for our positive cases, you can kind of see that our 20 to 29-year-olds are about 33% of our cases, followed pretty closely by our 0 to 19 years old at 22%, and then the 30 to 39 is about 17%. And as it stands today, we have a breakdown of pretty much 50% on our on the genders with females and males. And this just indicates the links to the contacts. So as you see that the isolated cases we've had, 71 were single isolated cases, and then 73 can be linked back to one of those isolated cases. This just shows our positive cases from our first positive back in April all the way to today. And it shows that you can see the kind of the spikes there in May and then again in September. And we'll just keep updating this every 2 weeks to indicate and show all of the different data that we're collecting. So thank you. And the next community update is Thursday, November 5th at 7 p.m.
Thank you, Mona. And a reminder that people can email questions to covid@winnebagotribe.com, and we will be doing a Q&A at the end of today's updates from all of the tribal organizations. So next up, we will go to Dan Farringer with Winnebago Public Schools. Dan?
Good afternoon, everyone. WPS is back in session. We have been in session for 3 weeks now. We are following the health directive measures, temperature taking, wearing masks, hand sanitizers throughout the building, and social distancing. We also have student place things to keep shields on their desk. Students are telling us that they want to be in school, and some have asked, please don't close again. We hope that can happen. Activities are happening. The fall sports are almost complete. We have volleyball on Monday, the districts, and then the fall seasons will be over. Again, a letter came out from the Board of Education regarding parents and students of the homebound that are homebound. We want to appreciate and thank those families that are fulfilling the obligations and responsibilities of the homebound contract. There are many doing that. But after 6 weeks, we as a district, teachers, administration, and school board are concerned about the number of homebound students who are not completing assignments, not checking in on their assigned times, and failing classes. All WPS students, whether in person or homebound, are expected to meet the educational requirements. If requirements are not met, students will be retained in their current grade, including students who are seniors. Again, this is, we have that letter. It's on our Facebook page and website. On Friday, October 23rd, tutoring will be offered to those 712 high school students and junior high students who are behind and need help with their assignments. There will be teachers here from 8 till 3:30 to help students. On Friday, October 30th, we'll offer it to the K-6 students who need help. And we're making contacts with those parents. The principals are doing a great job of that. There will be teachers here to help those students. Again, on November 13th, we'll be back to the 712 students. We're trying to do things to ensure that our students have the opportunity to stay caught up. We'll announce more tutoring dates as the semester goes on. We also will provide lunch during that time. Our kitchen staff has been great doing that. Again, we require everyone that enters the building to take his or her temperature, wear a mask, and sanitize hands. It is imperative that we continue to follow these health safety measures for the safety of all of us. Thank you.
Thank you, Dan. Next up, we will go to an update from Little Priest Tribal College, President Manoj.
Good evening, Winnebago Tribe of Nebraska. I hope you and your family are doing well and staying safe. We have quite a bit of updates from Little Priest Tribal College. Our board of trustees yesterday approved the spring 2021 schedule. I'm delighted to share that if you are a Title IV eligible, I want to repeat this, if you're a Title IV eligible student, which many students are, we we have really making this offer exciting for you to continue your higher education. If you're a full-time student, you get 4 free classes and 2 free textbooks and a free laptop. If you've already obtained a new laptop the fall 2020 semester, you will not be getting a new one again. But if you're a new student, you'll be getting a free laptop. Again, 4 free classes worth thousands of dollars. That means you are going to get a huge refund from Pell or Higher Ed or the AICF. I've been in constant contact with our financial aid office, and what I'm going to request today to the community, the parents, the students, if you submit an application for AICF scholarships, which doesn't take more than 10-15 minutes, you will get tremendous amount of scholarships. Unfortunately, many students are not even applying for the scholarships. And we feel a little disheartened that you're losing the money. Especially during the COVID-19 pandemic, every dollar matters for your living expenses, to take care of yourself. So I would like to take this opportunity to all my friends, colleagues, community members to reach out to each other and help them apply for scholarships. Again, going back to spring 2021, if you're a part-time student and if you're Title IV eligible, you get 2 free classes, plus the free textbooks, plus the laptop. And please remember, to be a Title IV eligible, the minimum requirement is you have to do a FAFSA application and you have to be degree seeking. I know this can get confusing, but we at the college are here to help you guys, guide you guys. So pick your phone and call 402-878-2380. One call can save thousands of dollars and can make sure that you graduate on time. As a college president, it's my job to make sure that if you're having any issues, we come to your rescue and we solve your problems. So again, I'm going to request the community to help each other and to support each other to get this done. We don't want you to lose this opportunity. I don't think so any college I have been in my past experience have offered free classes like this and a free textbook and a free laptop. Now is the time for us to be as a community to come together and continue our learning. I can't emphasize enough. If you are a returning student, that means you're already a student at Little Priest, please contact your faculty advisor and sign up for the classes. We will be updating our Facebook and littlepriest.edu website for spring schedule. And if you're a new student registering at Little Priest for the first time, contact the admissions office and the director of admissions, Maria Garcia. Again, some of the classes have a limited seating capacity. We anticipate with free classes, some of the classes will be filled up very fast, and we don't want you to lose this opportunity. So don't wait. Get this going. Get signed up, and we'll take care of you. Also in spring 2021, COVID is still there, but we are bringing some of the students back on campus. So we have 4 different modalities we are offering. And I want the community to listen to this very carefully. Some of the classes are face-to-face. That means they come to the campus, they stay on the campus during the classes, especially the lab components. Some are hybrid. That means the lecture is online, the lab is face-to-face. Some are completely online, just like what we are doing right now in the fall semester. But the 4th one, which is probably the newest technology, is called a high-flex model. And we'll put more information out about high-flex model, but let me explain what it is. So for example, if one of your family member, or if you are not feeling well, but you don't want to miss the lecture, you basically log into our system called the HighFlex system. So in the comfort of your home, you can actually see the lecturer, the instructor, and your classmates through a webcam or a camera, and you can see the lecturer, instructor talking about the class stuff. So it's not like you're missing anything. It's not online where it's an asynchronous. HighFlex is synchronous. It is happening at the same time. So, but if you want to be in the class, you can go to the classroom and sit there. But if you want to stay home and if you want to take care of somebody or if you have any symptoms, you still don't miss the instructor. You can actually unmute and ask questions. So it's live, it's synchronous. And Little Priest Tribal College is investing thousands of dollars to make this happen for spring 2021. And also, we are working on a plan to allow some students to use the dorms. Right now, nothing has been confirmed yet, but we are working on a plan of how the dorms will be used for students in spring 2021. All students coming to the campus will have a temperature check. If you don't have the mask will be provided. So during the class time, during the lab time, during the hallways, you have to be wearing mask. So there is a strict mask mandate during spring 2021 as well. Also at Little Priest Tribal College, we are actually getting a new building, what we call a modular IT building, an information technology building, funded by the federal grant CARES Act funding. We are absolutely excited to have a new structure on campus, a new infrastructure that can provide leading technology and uninterrupted technology to students during this pandemic times. And we are hoping that will be installed and ready to be used for spring 2021. We are also anticipating a soft opening of the new building as well. So we'll be keeping you guys posted. But we are absolutely excited that we have a new additional facility on campus. As of right now, the fall semester is going really well, but we request students not to let their guard down. The semester is ending in December. Grades matter. Attendance matters. So don't let your guards down. Even during this tough situation, I'm pretty confident you can work hard and make a successful higher education as your main criteria of your growth. I really believe this is an important time for not to let your guard down. Stay safe. We are here for you. And if there is anything we can do, please give us a call or send us an email. And we want to take care of you. Have a good day.
Thank you, Manoj. Next, we will go to Sam with an update from HCI. Sam?
Good evening. I have 2 items for our portion of the update. I'd like to start with the Winnebago location of the Sweetwater Cafe. The location Tuesday for a few days out of an abundance of caution. Safety and social distancing guidelines have been in place, so we believe any customer risk is very low. We're using this time to deep clean the location and perform a disinfecting fogging. We'll share updates as they're available. Our thoughts are with the individuals recovering. Secondly, I'd like to talk about the upcoming general election on November 3rd. If you have not yet voted, please make a plan to do so. This Friday, October 23rd, is the deadline to register to vote in person. There are 3 initiatives on the Nebraska ballot that affect the Winnebago tribe. We are asking for your support of initiatives 429, 430, and 431. Voting for all 3 would legalize casino gambling at licensed horse racetracks in Nebraska, then create a gaming commission and tax that casino revenue. Ho-Chunk Inc. is sponsoring this effort, which would create more than 4,600 jobs, including jobs for tribal members, and significantly increase the size of the company. Because the Winnebago tribe owns Ho-Chunk Inc., This would mean significant economic benefit for the tribe. So for this to pass, voters must vote for all three measures, 429, 430, and 431. Remember, each vote truly matters and makes the same impact, whether you're in Thurston County or anywhere else in Nebraska. If you'd like to learn more online, just search Keep the Money in Nebraska and also like the Facebook page for Keep the Money in Nebraska. Those are my updates for today. Thank you for your time.
Thank you, Sam. And next up, we will turn it over to Winnebago with an update from Mayan Beltran. Mayan?
Good evening, Winnebago community. We also would like to offer our condolences to any families that are in mourning. And from the Winnebago Casino Resort this week, we have had a positive case that we were reported yesterday, and we have two others that are being tested today. We will hear back from their results in a few days or however soon that rapid test comes back. And we have one other with close contact that's on home confinement for another week. So our protocols have been followed. We have done deep cleaning. That's one of the reasons we close every night. We do a deep cleaning. We use the fog machines to disinfect. And in these areas that these individuals were, have been deep cleaned. And then we start our contact tracing throughout the facility. Another announcement would be that we are also doing flu shots for our team members here. Tomorrow is day one from 7 a.m. to 5 p.m. And then on October 28th from 2 p.m. to 6 p.m. in our Human Resources Department. So all team members at Winnebago come in for your free flu shot until they're gone. As always, we recommend make sure that you wash your hands, wear your mask, social distance, and be safe out there. Thanks, everybody.
Thank you, Mayan. Now we will move into the question and answer portion of this update. Thank you to everyone who submitted questions. Again, you could submit your questions via email to covid@winnebagotribe.com or via Facebook Messenger through the tribe's website. The first question was submitted, can you get the flu and COVID at the same time? Will these mass flu shot events be a potential spreader of COVID? Mona, can you go ahead and answer that one from the public health perspective?
Sure. It is technically possible to have both the flu and the COVID-19 at the same time because they are different viruses. However, it is extremely uncommon. There's only been a small number of known cases of patients having both illnesses at the same time. Also for the flu shot events that do occur, we will be minimizing those exposures as much as we're able to. Of course, masks and distancing will be in effect. We have actually started doing flu clinics at the businesses. And of course, if you're an elder, you can have the public health nursing come out and administer your flu shot. And I believe that pharmacy is already offering those. And if you come in for your outpatient appointment, you can request to have your flu shot administered there as well.
Awesome. Thank you, Mona. The next question is about the CARES Act. Can we get a CARES Act budget update? Is all the money going to be spent or will the tribe have to send some back? Chairman or Chairwoman, do you mind answering that one for us?
Thank you. Certainly, I'd like to give a brief overview of the budget, and the tribe will not have to send any of that money back. And the COVID task force has done a wonderful job of allocating that to various subawards across the organization. There were two pots of money. There was the CDC money that we got from the Centers for Disease Control, and the CARES Act money that came from the Treasury. And each of those were allocated to various topics: housing, food security, tribal departments, communication, security. There was pass-through funds to WCHS, WPS, Winnebago, HCI, and Atlas for the food pantry. And just to highlight some of those projects that, you may have seen underway and had questions about, under housing, there was a priority to establish a continuum of housing options to prepare for an increase of COVID cases. And we needed to establish a sufficient inventory that would not only create isolation and quarantine needs, but also be able to respond to any additional waves we had. And so the Tribal Council and the COVID Task Force thought it was critical to develop a range of housing options that would meet not only individual needs, but different family households and eligibility factors. Some of those projects and deliverables included adding or upgrading paving to 2.5 miles of reservation roads to ensure that first responders and health services would be able to be accessible to some of those homes on those roads. Increasing 6 units of tiny homes, single-family homes to be utilized for quarantine housing. The addition of 10 campers that are going to be used for temporary quarantine or isolating housing. The development of a women's shelter for women in need and a safe location for isolation housing. A bath and shower facility at the Powell grounds, the Veterans Park, so that campers and trailers would have that sanitation adequate for that space, ensuring that tribal members had the resources to maintain their current homes via rent and utility assistance. And that project is at 50% completion. Some of the food projects that were meant to enhance components of our local food system and ensure that reservation residents had access not only to healthy foods, but to limit the exposure to themselves and traveling to get groceries and things. Our projects have addressed immediate nutrition needs and those also suffering directly through the economic impact. By way of increasing the capacity of our local food pantry system distribution, by supporting efforts to process, preserve, and store food more in our community, and enhancing our ability to grow more. So not only have we really developed a robust food pantry program and partnership with Atlas and adding to what all the good things they were already doing, but we also started concentrating on food sovereignty more. Some of the tribal departments who are a very important part of the local government, we needed to support the needs of that by not only keeping our tribal employees and community stakeholders safe through PPE, sanitation upgrades, installation of barrier safety equipment at program facilities, increasing our program's IT capacity to enable telework, delivery of tribal services and access to public health and safety information, providing hazard pay, increasing staff, contracted services, and really just trying to meet the demand of programming that would support the need during the pandemic. As far as communications, there's also been a variety of projects that have developed over that for not only direct tribal programs, but community partners and tribal members in the areas of increasing access to telehealth, telework, transitioning to digital learning options for some of our students. And our CARES communication project will focus on increasing that technology capacity. Some of those include the increased internet and wireless access across our service area by installing 4G upgrades aligned with our current public schools, tribal colleges, health providers, initiate a 5G community upgrade, upgrade the tribal facilities and programs with enhanced telecommunications capacity. As far as security, they've really put a focus on ways to ensure public safety, oversight, emergency response, and police enforcement at this time by way of increasing by 5 the number of equipped police officers with vehicles to adequately respond 24/7, increased by 10 the number of security officers, and you may have seen them around the buildings checking temperatures and things, increased communication and oversight for public health, assist with transportation needs with quarantine and isolation and COVID patients. Also a variety of pass-through projects as mentioned to WCHS, WPS, Winnebago, HCI, the food pantry. So these are just, some high level details of some of the good projects that are underway, but I think that we could possibly get something in the wind and just really put something out there for the membership that aren't able to capture some of those details. So thank you.
Thank you, Tori. And kind of referencing to everything you just mentioned, the next question was, I heard the tribe purchased 20 RVs and 10 cop cars. Why?
The RVs, as mentioned, to create more options for isolation and quarantine housing, and also with the cop cars to continue to support our emergency responsiveness and that ensure that our existing law enforcement had the capacity to respond as events and things come up, and this was a good use of those resources to ensure that we had the proper equipment.
Great, thank you for that answer. Next up was, what is the new council's stance on COVID-19?
The health and wellness of the community and tribal members and our response to COVID-19 remains a high priority for the Tribal Council. And I'd like to thank former Chairman Brown and Councilman Snowball, who's the chair of the COVID task force, for their work that have supported all these efforts, and also the Tribal Council that have really been instrumental in working with the task force to give the approvals. And so we will, carry that forward and maintain the highest regard for the safety of our community.
Great, thank you so much. Switching gears, there was a question about telehealth, and it was if we had telehealth and teletherapy yet. Mona, do you want to take this one?
Sure. The behavioral health program has had the capability to provide teletherapy and has been offering that to the patients. If you're located in Winnebago, the CHRs have been able to take out an iPad to the clients. This is also occurring for the diabetes clinic as well, and they've both been reporting that it's going very well and has been well received. And I'm sure that maybe Janelle can speak to more of the outpatient clinic and how that has also been probably working very well with the CHRs also taking the iPads out for the outpatient clinics as well.
Yes, that's correct. We do have telehealth available as an option, just depending on your needs and out of your, sorry, I'm having a slow internet connection here, it looks like. But so looking like my webcam is slow. But anyway, we do have telehealth, ironically, and it is working very well. And we're, working with patients to make that available and connect you with your providers in a safe way so you can do that from home.
And just to add to that too, patients who are interested in telehealth can call the outpatient clinic at 402-878-3404 and ask the nurse and their provider if they're eligible for telehealth, and that will be set up that way too. So thank you both for that answer. The next question is, what's the reason that the country is spiking again? Are we thinking about shutting down, and what is the threshold? So I don't know, Danelle, Mona, if you want to take that, or anybody has other comments on that.
I can start, and then if Mona wants to add to the response to that, she can do so. I think that, as everybody knows from watching the news, there's increasing cases throughout the country, including in Nebraska and South Dakota, Iowa, and our surrounding area. And it's just, what we've been talking about for quite some time, throughout this whole pandemic, that there is a continued need for everyone to wear masks and to practice social distancing, limit your interactions with people that are outside of your household. And that's really the way that we can contain this pandemic, is to limit exposure to other people, because we really don't know who might have COVID, since some people could be asymptomatic. So we just really need to continue to be careful, sanitize your hands, sanitize high touch areas, wear your mask, and limit your contact with people outside of your home. And the more that we can all do that and stay focused on that, then the sooner we can combat this virus. And as far as thinking about shutting down at this point, we do not have any plans, at least locally, to shut down. And I haven't seen any reports of that from the state government and other, authorities in the area. But we are continuing to monitor the situation, and we'll continue to adjust as needed. And I think that we've learned a lot about the virus over the course of the last month, and we've learned that the wearing masks and the sanitizing and social distancing are the tools that will help keep us safe.
Got it. Thanks, Danelle. I think we had a comment from Manoj. Manoj, did you want to say anything?
Yes, just to want to, as we're talking about the COVID and the impacts that people are having, I just want to reiterate that Little Priest Tribal College has a mental health counseling opportunity for students. So please contact Tricia Wagner, and she can connect with Morning Star Counseling, and it is free of charge for all students at Little Priest Tribal College. And we really believe it is helping our students go through this phase of life and get the assistance they need. So thank you for your time.
Great. Thank you for that information, Manoj. The next question was about homeschooling some of the kids. The question was, I saw that the public school is having a hard time homeschooling kids. Can the task force help the parents with some resources or hardship money? We have to work, but if we can get some relief, it would help. Corey, can you cover that?
Yes, thank you. And I understand some of the parents are trying to juggle work schedules and trying to keep their children safe, but there currently hasn't been any discussion for direct assistance or money to those parents. What has been discussed are things with the school like tutoring, and Mr. Farringer has been, part of and will continue to be a part of those discussions with some of the task force work. One good thing is that the COVID-19 response internet cafe is now open, and that is creating access to Wi-Fi in a socially distanced setting, Wi-Fi connectivity, printer, copier access, cubicles available, and that's in the lower level of the Woodland Trails building in the Ho Chunk Village. That's now open Monday, Tuesday, Wednesday, Friday from 9 a.m. to 7 p.m., Thursday from 9 a.m. to 4:30 p.m., and at that time, at 5 p.m., they'll do a deep cleaning. Saturday and Sunday, it's 10 a.m. to 2 p.m., and so the hope is that that's a place to create access to Wi-Fi and hope that would help some of the gap in resource and a tool for education. But perhaps in the future there could be tutors there as well. And so the task force continues to take this feedback and look for solutions to answer the needs of the community.
Awesome. Thank you so much, Victoria, for that information. The next question is, I've seen a lot of 70 plates during the food distributions. I thought the food was for our elders and those in quarantine. Who is monitoring that? And I never know when those are. They post, and then by the time I see it, they are already done. Tori, do you care to comment on that?
Sure. The task force also has been aware of this concern, and they've talked about and implemented with the help of Atlas a regular schedule so that tribal members and community know when they can access those distributions. And the task force also discussed, some outside maybe folks coming in to pick up, and in some ways maybe the perception that that's taking from our community. And the task force, and the true values of the Ho Chunk people thought that, we never want to be stingy with food either, and that that they will continue to press that these funds were acquired for the use and benefit of the Winnebago tribal members and community, but in true Ho Chunk way, that we would never be stingy with food either. So I think that's some of the feedback that we got from the task force, and that we continue to monitor that and promote that it was for the Winnebago community.
Got it. Thank you. The next question is, what is the health department's plan for the holidays? How do we celebrate Christmas, New Year's, and Thanksgiving? Also, we spike in depression and alcoholism during these months. What's the plan to address those concerns? Mona?
Okay, so big question. Let's see. Thanksgiving is a time, obviously, when many families travel long distance to celebrate together. But remembering that travel increases the chance of getting and spreading the virus that causes COVID-19. So, of course, staying home is the best way to protect yourself. But if you must travel, be informed of all the risks that are involved. And some of the lower risk activities could include like just having a small dinner with obviously people that live in your household, preparing traditional family recipes. You can also deliver meals in a non-contact way to others, as we've been doing. Virtual dinners, shopping online rather than going on Black Friday or on Monday after Thanksgiving, and watching the sports events and parades and whatever from home. There could also be some moderate risk activities, which would include having a small outdoor dinner with family and friends who live in your community. Also, make sure that if you're going to visit the pumpkin patches or the orchards, that you make sure that you're using hand sanitizer before touching any of the pumpkins or picking apples. And of course, wearing your masks is always recommended, and keeping your social distance from others. And then some of the higher risk events or activities during these celebrations would be going into the crowded stores. On Thanksgiving Day now is the new Black Friday, I guess. And then, of course, Black Friday. And then having any participation in the crowded parades. And then just large indoor gatherings from people that are outside your household. So I always like to remind people that the alcohol and behavioral health programs are available. They've been available throughout the pandemic. And so if you need to schedule an appointment, please contact them directly. You can always use social media to, stay in connection with your family through the holidays. And unfortunately, we're just in a different time during this pandemic, and we just have to do what is appropriate for each of our families as best as we can.
Thank you for that answer, Mona. The next question relates to Whirling Thunder. Do we have a plan on when that's going to open up for the gym? And that includes what the plan is for any sport league, basketball practice, and the physical activity or events that normally happen around this time.
So we're constantly monitoring, obviously, what Danelle said, the situation around us, what's going on, the cases in town, what that looks like, and remembering that contact sports are contact. So it's very hard to keep people apart, especially like during basketball or any leagues. So we are continuing to monitor it. And so we will revisit this probably in December to see whether we're going to allow any activities in the gym to open up.
Thank you. This question is regarding the hospital. So Danelle, if you could take this one. It asks, does the hospital report how many of their workers test positive for COVID to the tribe? If so, how many have tested and how many are positive? I heard the hospitals allow positive workers to work if they wear PPE. Is that true?
Yeah, thanks, Emily. So the hospital follows the CDC guidelines with regard to potential COVID exposures or employees testing positive for COVID. And we have an employee health nurse who helps to track this and monitor this. Of course, we have strong guidelines in place and requirements in place for all of our staff to wear PPE while they're at work and to take precautions even outside of work. And so if a staff person is exposed or potentially has symptoms for COVID, we have testing available for all of our staff. And so that is available. If they need to be tested, we can test them. Those reports are not directly made to the tribe, but we do, like I said, have our employee health nurse and a small committee who regularly monitors that and reviews that. We work very closely with the public health nursing department, also in cooperation with employee health to do contact tracing if anybody is exposed or does come into contact with COVID. And with regard to working, we do not and would not allow a staff person to come to work if they tested positive for COVID. So that is not the case. If somebody is exposed to COVID, either at the hospital or outside of work, again, we follow CDC guidelines and evaluate the risk of that exposure. If there's a very low risk of exposure, it is possible that we may let somebody work, but they would only do so with increased wearing of PPE and increased monitoring by employee health on a daily, well, multiple times a day actually, of temperature monitoring and any symptoms and that type of thing. But we do take this very, very seriously. We want to keep our staff safe. We want to keep our patients and our visitors safe. And so it's something that we, again, monitor CDC guidelines and look at what our current situation is with COVID and making sure that we take all the precautions that we need to keep everybody safe.
Thank you, Danelle. The next question is, do we have to report the household assistance on our taxes? Tori, can you answer that one?
Sure. The tribal members have not received any direct payments, so you would not have anything to report on your taxes.
Great, thank you for that information. The next question is, how come we're just getting food distribution? To be honest, I think I have too much food and they should do house cleaning supplies like laundry soap. Some of the food is going to waste. Cleaning supplies has a longer shelf life and will be used for sure. I don't know if Tori or Mona, if you want to answer that one.
I can answer that. We can definitely take that under advisement and message that back to the task force as they evaluate use of those funds and some of those subawards. So thank you for the question.
Great, thank you. The next question is in reference to the mention of existing health issues. They keep saying existing health issues in relation to COVID. Is being Native one of those? Seriously, aren't our bodies different from white people? Are we studying that? Mona, can you answer that?
Sure. I think the last report that I've seen was back in July from the CDC, which indicated that Alaskan Natives and American Natives have a disproportionate affected by COVID-19. And that is because of the existing health issues, as you've described, whether that's from asthma, diabetes, and any of the other chronic diseases that we face. It doesn't really indicate exactly currently what it looks like at this time. So I just know that back then it was about 3.5 times more likely that Native Americans would get COVID over non-natives. So that's why we are constantly saying to wear your masks, be reminding of being social distance, because it is affecting us differently. And so just like any of these other diseases, is that we need to take the precautions that we need to protect ourselves.
Thank you for that answer. The next question is, the tribe had powwow in September and it doesn't seem like any cases were related. When is the next powwow? I'm hoping Veterans Day and New Year's for sure. If the NFL can have football on Sundays, we should be able to dance and sing for our people. Mona, can you take that one too?
Sure. So the Veterans Ball, or the September Power Homecoming was outside. So people were able to dance and
I think, are you guys having?
Veterans Day and New Year's
Yeah.
Eve is a lot further away inside. And so that doesn't
Mona,
like the
sorry. You were cutting up. I don't think we got any of that. Do you want to start over? Sorry.
That's okay. The internet now. No, I'm just kidding. Okay. I don't even know where I was. Oh, okay. So I'm sorry. The powwow in September, the homecoming celebration was all outside. So the people were able to dance and sit further away from one another. Typically, Veterans and New Year's Eve is inside. And since we're all doing still a lot of virtual activities and really limiting that interaction, I would not be in support of having a powwow inside. Of course, everybody and anyone can dance and sing within their own households as they wish and enjoying that time. And I know there's been a lot of virtual interaction and seeing on social media. So, we just need to still continue to look around the surrounding areas because they have been.
Okay. I think we're getting cut off again. Yeah, I think we got the most of it. Thank you, Mona. The next question is for Tori. When is the council going back to in-person meetings?
The Tribal Council has a standing motion to meet virtually. I think that can be reevaluated. Also keeping in mind some of our council having some of the maybe not only pre-existing conditions, but some of the CDC outlined conditions that would increase risk and health complications with COVID. But with that said, I think as a community, we continue to monitor the pandemic and how we will respond to not only how we operate as an organization, but how we meet as a council. The part about I don't think it's fair that everyone has to come to report to work. There is no policy that tribal council members are not expected to come to work, and I think the membership has been clear that if they want to speak with their tribal leadership, that they would be available to them. So I will convey that and reiterate that we need to be here for our membership and have access to some of those conversations with the proper PP, the face masks and PPE and everything that we need to do to continue to work and serve our tribal members. So thanks.
Thank you, Tori. Do they offer coffee and food at the Internet Cafe? One of the community members asked that question.
Unfortunately, they do not. They are just offering state-of-the-art Wi-Fi at this time.
Thank you. And then the last question is for Mona. Having COVID while pregnant, will that affect the baby? Mona, can you answer that?
So unfortunately, studies are still being conducted. It does suggest that pregnant women are more likely to be hospitalized and are at an increased risk for ICU admissions and being on the ventilator. But it's unclear at this time of what effects that would have on an unborn child. So right now, the risk of death is very similar for those that aren't pregnant. So I guess we just have to continue to monitor it and see what other research is produced after this has been going on for a few more months.
Got it. Thank you for that information. So that concludes the Q&A portion and community update for this week. I want to thank everyone who submitted questions. And again, give the email address that you could email your questions to. It's covid@winnebagotribe.com. And we will try to answer those in our next community update, which is scheduled for Thursday, November 5th at 7 p.m. And that's 2 weeks from today. Thank you all for joining us, and thank you all for watching. I wish everyone a happy and safe Halloween, and we'll see you in 2 weeks. Thank you.
Thank you.
Bye.
Thank you.